to treat a patient with Tixel 2. Before the treatment, review the patient's skin type and condition. Check for contraindications. Explain treatment options and discuss patient preferences and expectations. Wash the treatment area with soap and disinfect the patient's skin using an antiseptic lotion. At high settings or sensitive patients, it is advisable to apply analgesic cream about 20 minutes before treatment. Marking the face with a dermatological pencil helps to better follow the treatment pattern. The treatment can be performed with low, medium, or high energy settings depending on skin type, condition, desired outcome, and patient downtime preferences. 2 to 6 treatments may be required for optimized results depending on energy settings. It is recommended to start with reduced settings in the first session and to increase gradually considering patient's response. In this demonstration, facial skin resurfacing treatment is performed at 10/400 settings. Select handpiece icon and settings. Remove the facial handpiece from its cradle. Perform a test pulse in the air. Place the distance gauge flat on the skin in a perpendicular manner. Press gently to ensure good contact between skin and distance gauge. Press the trigger gently and release. Lift the handpiece and move it to the adjacent site and reactivate the trigger. The pulse rate is typically 1 pulse per second. Flatten the skin gently when necessary to prevent skin from bulging into the distance gauge. It is recommended to work in a crisscross mode on deeply wrinkled segments. At the end of the facial treatment, place the handpiece back in its cradle and select the periorbital handpiece icon. Settings 8/400. Use the periorbital handpiece to treat the narrow areas around the nose, deep wrinkles on upper lip, deep acne scars, stretch marks, and more. Once done, place handpiece in its cradle and select the cleaning icon to start cooling down the handpieces. Doctors recommend to cool and disinfect the patient's skin with hyperchlorous spray after treatment. When dry, apply Cetaphil moisturizing lotion or similar. At the end of the treatment session, instruct the patient to apply moisturizing lotion every 6 hours and to follow the home care routine. You can now proceed to tip cleaning.